Good afternoon, everybody. Today is the eighth session of the Zoom review. We should be finishing up the lower extremity today on the muscles. Then tomorrow we will kind of bring back the bones and correlate them to the muscles, so that when you hear a bone, you should be able to tell me what muscles are coming off of there as origins and what muscles are coming onto there as insertions. Again, I do apologize for the earlier hour for this meeting today. We do have a meeting on campus at 3 o'clock, so I have to be a part of that meeting. So I'm going to make this meeting until right around 2:30, and then I will set up for the faculty meeting. Again, if you have any questions, please feel free to email me. I'm not seeing a lot of questions, unfortunately. Hopefully over the next couple of weeks, as we finish up these reviews, you guys will actually have some more questions. Again, we have 2 more weeks of class here. Then we are on vacation for 3 weeks, which means 5 weeks from today, class begins. You guys will be walking in the door here, coming up to the 2nd floor, and we'll be starting class. At this moment, we have approximately 21 students in the class. We will be splitting you guys up into 2 classes, most likely of 10 each. The way it'll work is I will be in one class doing the lecture material. We will have either a Zoom video, or we'll be working off of Blackboard, which will be connected to the room next door, and you'll be able to see what's going on film there. And there will be an instructor in here, so that if you do have any questions, he'll be able to stop me, and I'll be able to answer, or Mr. Ingerman will be able. So we left off on Thursday of last week. We finished up the upper extremity, and we're starting on the lower extremity. My hope is that we'll be able to finish up the lower extremity today. So I'm going to just make sure that I am recording, which I am. Fantastic. I will go to the share screen. I will bring up the PowerPoint. And we will begin. All right. So like I said, we're going to be starting with the lower extremity. The lower extremity has much larger muscles. The much larger muscles are found in the lower extremity. The muscles of the upper extremity are really used for precision and smaller activities, smaller muscles. The lower extremity muscles are less on precision, more on strength, because we need to be able to stand up, maintain our balance, to walk and to run and to cut. So the movements are a little bit larger than lower extremity movements. We have many muscles of the lower extremity cross 2 joints, such as the rectus femoris, one of the quadricep muscles, the biceps femoris, semitendinosus and semimembranosus of the hamstrings. The gastrocnemius crosses the knee, and it has ankle movement also. And these are going to be important muscles when we discuss in kinesiology certain what we call insufficiencies. Because when we have a two joint muscle, we have a muscle that works at both joints. And if they're working at both joints, they're contracting at both joints, which means they're really, really shortening if they're doing the action at both ends. Such as, let's take the rectus femoris or the quadriceps. Well, it does knee extension, but it also does hip flexion. So if those actions are occurring at the same time, the muscle is very, very short. So it is not a lot of strength going on. So when we're talking about the leg is the part of the limb between the knee and the ankle. And when we're discussing the foot, we're going to be discussing the foot as the tarsal region and the metatarsals. We really, we won't be working with the toes, and we won't be working with multiple layers of muscle of the foot itself. We're going to be working with specific muscles of the lower extremity and the foot. Now, we'll start with the hip and the femur. And the most important muscle of the hip and the femur is known as the iliopsoas. The iliopsoas muscle is a combination muscle. It's made up of the iliacus muscle. The iliacus muscle comes off of the iliac crest of the hip. And also the psoas major, which comes off of the lower thoracic vertebra and the lumbar vertebra. So if you take a look at this picture here, this long muscle right here is the psoas major, all right? And it attaches to the lesser trochanter right here. And right here, this muscle right here that's on the ilium is known as the iliacus muscle. And the iliacus muscle also attaches to the lesser trochanter. Now, both of these muscles, when they work separately, are flexors of the hip. Because we are basically going to combine these muscles, I want you to think of the iliacus and the psoas major as one muscle, the iliopsoas, just like the rhomboids. We know we have a rhomboids major and a rhomboids minor, but in our thinking, I want you to think that the rhomboids is just one muscle. The iliopsoas muscle is the strongest flexor of the hip in the body. All right. It is the strongest flexor of the hip in the body. This is a very important muscle, which we will be going over right now. So the iliopsoas, it's like I said, it's made up of two muscles, the iliacus muscle and the psoas major. So the psoas major muscle is in red right here. That's the psoas major. It's a longer muscle. It's coming from T12 through L4. And it inserts into the lesser trochanter of the femur right here. So you can see how this muscle comes down and attaches. And the iliacus muscle is in blue, and that's coming off of the ilium and also attaches to the lesser trochanter of the femur. So the origin of iliopsoas is the transverse processes of the lumbar vertebra and the iliac fossa. Transverse processes of the lumbar vertebra and also the iliac fossa. It inserts into the lesser trochanter. It's innervated by the femoral nerve. The job, its main action is hip flexion. And it just happens to be the most powerful hip flexor muscle in the body. So the iliopsoas, the strongest hip flexor, comes from the transverse processes of the lumbar vertebra and the iliac fossa. That muscle inserts into the lesser trochanter of the femur. It is innervated by the femoral nerve, and its main action is hip flexion, and it just happens to be the strongest hip flexor in the body. In the back, we spoke about the erector spinae muscle, and here's a picture of it. What I need you to know is just a couple of things. The first thing I need you to know is that the erector spinae work together to extend the back, to perform extension of the back. Now, the erector spinae is made of 3 muscles, and these muscles are spread out throughout the back, the cervical area, the thoracic area, and the lumbar area. I want you to know the sequencing of this muscle. I want you to know the sequencing from closest to the vertebra to furthest from the vertebra. So if they're close to the vertebra, it means they're close to the spine. The spinalis portion of the erector spinae is the most medial erector spinae muscle. It's closest to the vertebra. It's closest to the spine. The longissimus muscle is right next to spinalis. It's more in the middle. And finally, we have the iliocostalis muscle. The iliocostalis muscle is the most lateral muscle of the erector spinae group. Costalis means rib, which means this muscle is closer to the ribs, closer to the lateral side. So we have 3 muscles of the erector spinae. The spinalis is close to the spine on the medial portion. Longissimus is in the middle, and iliocostalis is the most lateral muscle of the erector spinae, closer to the ribs. And again, the job or function of the erector spinae is to extend the back, is back extension. Now, we have a lot of big, strong, thick muscles in the hip and the proximal femur. And a lot of these muscles perform lateral movements, and most of them are found on the posterior side of the hip. So some of the muscles that we're going to talk about is the tensor fascia lata, also known as the TFL. We're going to talk about the glutes as a set. Remember, there are 3 gluteus muscles. From superficial to deep, it's gluteus maximus, which is the most superficial muscle, gluteus medius, which is the middle muscle, medium, and gluteus minimus, which is the deepest of the glute muscles. And they all have different functions. They each have different functions. So it's really going to be important to understand what the glutes do and kind of separate them out, because they don't all do the same thing. Excuse me. This out of the way here. See what this is doing, what it's doing. All right. The first muscle is the gluteus maximus. The gluteus maximus. This is a large, thick muscle. All right. The glute max, you'll also hear it as. And the glute max is this big, thick muscle right here. All right. It actually, this is its attachment point right over here. The origin of glute max is the iliac crest, the coccyx, and the sacrum. So as you could see, it comes off of the sacrum. It goes along the iliac crest right here. So it's a large muscle, a large muscle. Gluteus maximus inserts onto the greater trochanter and the iliotibial band. It has a multiple insertion point. So as you can see, it starts at the top at the iliac crest. And that's going to be important to know because that's going to differentiate gluteus maximus from gluteus medius, all right, which is the muscle directly underneath the glute max. The job of the glute max, the main jobs, there are other jobs that this muscle does, but they aren't main movers. The main movement of gluteus maximus is hip extension and hip external or lateral rotation. Those are the two main movements of the gluteus maximus. Hip extension, bringing the leg behind you, and hip externally rotate, external rotation, bringing the hip outwards, bringing the hip outwards. Those are the two main movements of the gluteus maximus. Those are the ones that I want you to know. So again, the origin, the iliac crest of the hip, also the coccyx and the sacrum. It inserts into the greater trochanter of the femur and into the iliotibial band, which is that band of tissue on the lateral side of the leg. It basically goes from the hip all the way down to the knee. It's innervated by the inferior gluteal nerve, the inferior gluteal nerve, and the function or jobs of the gluteus maximus is to perform hip extension and hip external rotation. Those are the two functions of the gluteus maximus. The gluteus medius, I want you to take a look here. So as you can see here on the top here, here's the iliac crest, and there's nothing at the iliac crest here. The iliac crest is empty because that's where the gluteus maximus has its main origin. All right. So as you can see, there's nothing on the iliac crest for the gluteus medius. The gluteus medius is directly under the iliac crest, directly under the iliac crest. The gluteus medius also inserts into the greater trochanter. So gluteus medius inserts into the greater trochanter. Gluteus medius is innervated by the superior gluteal nerve. Remember, maximus is innervated by the lesser gluteal nerve. Excuse me. Gluteus medius has one very important job. Gluteus medius is the main hip abductor. Gluteus medius is a hip abductor. So glute max is a hip extensor and external rotator. Glute medius is a hip abductor. Now, when you get your cards, you're going to see a lot of other different motions for glute medius. All right. You might see hip flexion, internal rotation. All right. But again, these aren't the main movements of this muscle. The main movement of gluteus medius is hip abduction. It is the most important movement that gluteus medius performs. So again, I want you to take a look at this muscle, and I want you to compare it to what you saw on the glute max. The glute max is on the iliac crest. All right, it covers the iliac crest. Glute medius, you can see when we take off glute max, glute medius is underneath the iliac crest. Okay, so we have the very superficial glute max sitting on the iliac crest. Glute medius, which is a little deeper to glute max, directly underneath the iliac crest. Gluteus minimus is even lower on the ilium to the glute medius. So as you can see here on the top of the bone, you have a clear view of the iliac crest. You have a clear view of the area just below the iliac crest, where you don't have that view with the glute medius. So the glute minimus is deeper to glute medius and further down the ilium. Glute minimus is also on the greater trochanter. So as you can see, all three of these muscles are on the greater trochanter. Glute max, glute medius, and glute minimus. But glute max is also on the IT band. All three of these muscles are on the greater trochanter. Remember, glute max is the superficial muscle. Glute minimus is the deeper muscle, and glute medius is in between. Glute minimus, like glute medius, is innervated by the superior gluteal nerve. The superior gluteal nerve. Okay, so when we're talking about these three muscles, glute max is innervated by the inferior gluteal nerve. But medius and minimus are innervated by the superior gluteal nerve. The action of glute minimus, it does the same action as glute medius. It's a hip abductor. But it also does medial rotation of the hip, internal rotation of the hip. So let's kind of go through the movements of the glutes. Glute max does hip extension and lateral rotation. Glute medius does hip abduction. Glute minimus also does hip abduction, but glute minimus also does internal or medial rotation of the hip. Okay, so understanding these three muscles are very important. We work with the glutes a lot. Remember, the nerves, especially the sciatic nerve, comes out of this area. And a lot of times it'll be the piriformis muscle that's actually putting pressure on that sciatic nerve. And that causes a radiating pain down into the buttocks area, into the back of the leg, into the back of the knee, and even the back of the calf, into the ankle. That pain could actually radiate all the way down the leg with sciatica. So the glutes are definitely an area we work on a lot. We do a lot of stretching in this area to try to loosen up those muscles to take pressure, if there is any pressure or any kind of impingement on that sciatic nerve. So glute max sits on the iliac crest. Glute medius, its origin is right below the iliac crest. And glute minimus is below the medius. They each insert into the greater trochanter. But remember, glute max also inserts into the iliotibial band. Glute max is innervated by the inferior gluteal nerve. Glute medius and minimus are innervated by the superior gluteal nerve. And let's remember the actions. Glute max, it performs hip extension and lateral rotation or external rotation of the hip. Glute medius, only hip abduction. And glute minimus also does hip abduction, but it also does that internal or medial rotation of the hip. So it's very, very important to know your glute muscles. So the tensor fascia lata is a very, very interesting muscle because its origin, its insertion is kind of strange. The tensor fascia lata is a very small muscle. It's a very small muscle. So if you look at the picture here, this runner can actually put his hand over the entire muscle, literally. All right, to put their hand over the entire muscle of the tensor fascia lata, also known as TFL. The origin of TFL is the iliac crest, just behind or just posterior to the ASIS. Remember, the anterior superior iliac spine. And that is actually where the ASIS is actually where the Sartorius has its origin. The insertion of TFL is into the IT band. It's into the proximal portion of the IT band, right about here. So you see the red muscle inserting into this white band that goes down all the way down into the lateral knee. So the TFL inserts into the proximal IT band. TFL has its innervation as the superior gluteal nerve, just like glute medius and glute minimus. TFL has three important jobs. For a small muscle, it does a lot of work. The TFL helps flex the hip. Remember, iliopsoas is the strongest hip flexor. TFL does medial or internal rotation, just like the gluteus minimus. Sorry about that. That was my mistake. Gluteus minimus does internal rotation. And TFL, because of its position, is a strong hip abductor, just like glute medius and glute minimus. So tensor fascia lata comes from the iliac crest, inserts into the proximal IT band, a superior gluteal nerve innervation. It does hip flexion, internal rotation, and hip abduction. It is a busy muscle. It does a lot of work. Now, the lateral rotators are a bit confusing. All right. There's really 6 lateral rotators. I'm only going to need you to know one of them. All right. Now, as you can see from the picture, these rotators are kind of deep, and they're deeper than the glutes. They're deep to the glutes. Okay. And most of them are coming off of the ilium. So these lateral rotators are deep to the gluteus muscles. Now, I need you to know what these muscles do. Again, they do lateral rotation of the hip. Because as long as you understand what the muscle does when you hear it, that's what you need to know. So if we take a look at this list here, there's a list of 6 muscles. Only one of them you're going to have to know. All right. So I kind of call them brothers and sisters. Okay. So the Gemellus sisters, superior and inferior, those are lateral rotators. The obturator brothers, internus and externus, those are lateral rotators. When you hear gemellus or gemelli or the obturator muscles, you know that they're lateral rotators of the hip. Boom, done. The 5th muscle that you're not going to have to know, but I want you to understand it, is the Quadratus Femoris. Again, the name of this muscle is telling you its shape. All right, 4-sided. The muscle that you're going to have to know is going to be the piriformis muscle. When we get to kinesiology, you're going to learn that this muscle has an action at one position, and when we change the position of the leg, we can actually change the movement of the piriformis. It's a very interesting muscle. And if you've ever stretched out your piriformis, you'll understand, well, you'll understand more in kinesiology, but you'll understand how stretching it is so important. The piriformis basically sits over that foramen in the hip. And a lot of times the piriformis is literally sitting on the sciatic nerve. And when a muscle is sitting on a nerve like that, it's going to cause discomfort. It's going to cause pain. And it's going to cause something we call, pain that goes down the leg. Having a little word finding problem here. So once I get the word in my brain, it'll come back. It's a pain that travels down the leg. So that's why sciatica is so debilitating, because it can cause pain in the glutes, the back of the thigh, the back of the knee, the back of the calf, even into the foot. So again, the lateral rotators are the gemelli. You could just call them twins if you want, easier too. The gemelli twins and the obturator twins, there are 2 of each. The Quadratus Femoris is the 5th of the lateral rotators that you will need to just understand. Just want you to know that they're lateral rotators. We'll talk about the piriformis more in a second. So again, here's the Quadratus Femoris muscle. Okay, as you can see, it's like 4-sided right here. The 4-sided muscle, and it inserts onto the femur, and it helps externally or laterally rotate the hip. The obturator internus, one of the obturator twins, internus and externus. That's the muscle in red, as you can see, kind of comes off of the near the obturator foramen. The obturator externus, again, you can call them the twins. There's 2 of them, and they're both lateral rotators of the hip. The superior and inferior gemellus or gemelli, the gemelli twins are also lateral rotators of the hip. So again, you have 6 lateral rotators. 5 of them, I just want you to know that if you hear the name, you say lateral rotation of the hip. The gemelli twins, the obturator twins, Quadratus Femoris. Those are the 5 muscles that I want you to have an understanding of what they do. The muscle that you do need to know is the piriformis. All right, you need to know what the origin, insertion, innervation and action of this muscle. It's a small muscle. It only goes from the anterior portion of the sacrum to the greater trochanter. But as you can see, it's literally within that obturator foramen. And the sciatic nerve, as you can see in this picture here, comes out. These are the nerve fibers that are going down into the leg. As you can see, the piriformis literally sits on the sciatic nerve, and it can really cause great discomfort. All right, a radiating pain that radiates down the leg. It was going to come to me eventually. That's what happens when you get old. You have word finding problems, right? But as you can see from this picture here, these nerve fibers, and the sciatic nerve here is being pointed to. The sciatic nerve literally sits underneath the piriformis. Here's the muscle, and here's the nerve. It's literally sitting on it. Not a good thing. So one of the things we do as physical therapist assistants is we stretch out the hip muscle area, in particular the piriformis muscle. So let's talk about the origin, insertion, actions, and innervation. The origin of the piriformis, it comes from the sacrum. It comes from the front of the sacrum, or the anterior sacrum. It inserts onto the greater trochanter. Piriformis is also innervated by the superior gluteal nerve, the same nerve as gluteus medius, gluteus minimus, and the TFL. The piriformis has two important actions. It does lateral rotation of the hip, just like the obturator twins, just like the Gemellus twins, just like the Quadratus Femoris. Lateral rotation of the hip, main movement. But it also, when the hip is flexed, and this is the motion that we will talk a lot about when we get to kinesiology, because when the hip is straight, it really doesn't perform hip abduction, only when the hip is flexed. So when the hip is flexed, it does hip abduction. And it is one of the 6 lateral rotators of the hip. So it is the piriformis muscle that, as you can see, is starred. And I definitely want you to know this muscle. Very important muscle. We work on it a lot. This is a very deep muscle. Very deep. It's under glute max, it's under glute medius, it's under glute minimus. All right, those muscles are really thick. Each of these 6 lateral rotators are very, very deep. All right, very, very deep muscles. All right, let's continue on. Okay, so now let's get to the next set of muscles. These are more of the medial muscles on the inside of the leg. And these muscles do a lot of work about bringing the leg back from an abducted position. So these are the medial compartment muscles, also known as the adductor muscles. All right. And the main muscles are the 3 adductor muscles, Adductor Longus, Brevis, and Magnus. We have a small little muscle known as Pectineus. And then we have a long, thin muscle known as Gracilis. So let's go through each of these muscles. And yes, you're going to need to know these muscles. The Pectineus, I'm not going to have you worry about this one. Pectineus is a small muscle. It goes from the pubis of the hip to the femur, right near the lesser trochanter of the femur. Okay, what the job of Pectineus is as a hip adductor. All right, its job is as a hip adductor. It also does some internal rotation of the hip, as you can see here, just by its position. Here's the origin right here, and here's the insertion right over here. Put an eye there. If the insertion comes closer to the origin, it's going to move this femur in an internal or medial direction, and it's going to cause that rotation of the hip. So Pectineus does internal rotation, but it also does adduction of the hip, an important muscle in hip adduction, bringing it back from an abducted position. The gracilis muscle, there's a couple of things you're really going to know about. You need to know about this muscle. It comes from the pubis area. Its origin is the pubis. This is the red muscle in this picture. And it is a thin muscle. It is a thin muscle. So it comes from the pubis. You're going to need to know the insertion point. The insertion point of this muscle is very, very, very important. It inserts into the proximal medial tibia, the anterior proximal medial portion of the tibia. Its insertion point is right here. Anterior, the front, medial on the medial side, and proximal closer to the body. Remember, distal is further away. Anterior medial proximal portion of the tibia. That area, the anterior medial proximal portion of the tibia, where the gracilis inserts into, has a special name. It is known as the pes anserine tendon. The pes anserine tendon. The gracilis is one of 3 muscles that has its insertion in the pes anserine area. It is going to be your job to know the 3 muscles that insert into the pes anserine. So the gracilis is the first one. So again, the origin of the gracilis is the pubis area. It inserts into the anterior medial proximal portion of the tibia, known as the pes anserine. The innervation of this muscle is the obturator nerve. The obturator nerve. Gracilis has 4 important actions. 4 important actions. It flexes the hip. It flexes the knee. It adducts the hip, so it brings the leg back from abduction, and it internally rotates or medially rotates the hip. So gracilis has 4 actions: hip flexion, hip adduction, hip internal or medial rotation, and knee flexion. And again, the gracilis is one of the muscles that insert into the pes anserine. It's one of 3. And the pes anserine is on the anterior medial proximal portion of the tibia. That's the kind of question that I'm going to ask, because the national exam is going to ask you about the pes anserine. Okay, so please know the gracilis muscle. Some of the other adductors, all right, the first one, the largest of the adductors, is Adductor Magnus. It's the largest. It's Magnus, right? Magnus is the large one. It comes from the ischial tuberosity. It inserts on the posterior portion. It inserts onto the posterior portion of the femur, the area known as the linea aspera. Adductor Magnus inserts onto the linea aspera. It also inserts onto the adductor tubercle, which is the distal portion of the femur also. It's innervated by the obturator and sciatic nerve. The job of Adductor Magnus, thankfully the name is within the job is within the name, adductor, so it is a main adductor, and it also does hip flexion. Okay, so ischial tuberosity to the linea aspera, it does hip adduction, and it also does hip flexion. The Adductor Magnus. There are three important adductor muscles. The second is the Adductor Longus. As you can see, not as large as Magnus is. Magnus is this whole area right here. Oops. Magnus is this whole muscle right here. And it even attaches back here. All right? That's where Magnus is. But when we're talking about Adductor Longus, Adductor Longus is definitely not as large as Magnus is. Let me get rid of this picture here. So Adductor Longus comes from the pubis. It too inserts into the linea aspera. All right. It also inserts into the linea aspera. It does hip adduction. It does hip flexion, and it does hip internal rotation. So Adductor Longus, it's the lower circled muscle here, the lower circled muscle. All right, so it's this muscle right here is longus. Right here will be brevis. That's the smaller muscle of the three. Adductor brevis, again, is the smaller muscle of the three adductor muscles. It comes from the pubis. It inserts onto the linea aspera. So all three of these muscles go to the linea aspera. Remember, Adductor Magnus has that also area where it goes to the adductor tubercle, which is that bony protrusion on the distal portion of the femur. Adductor brevis also does hip adduction and also does hip flexion. So you'll notice Adductor brevis does hip flexion, Adductor longus does hip flexion, and Adductor Magnus does hip flexion. They each do adduction. The muscle that has a little bit different is longus. Longus also does, Longus has 3 actions. Brevis and Magnus only have 2. Longus also does internal or medial rotation. Remember, there were 6 muscles that did the lateral rotation. The Gemellus twins, the obturator twins, Quadratus Femoris, and Piriformis. Those 6 muscles did lateral rotation. So if you know those muscles do lateral rotation, then you'll know that longus, adductor longus, does internal or medial rotation. All right, so that was the medial compartment of the leg. Now we're going to go to the anterior portion of the leg. Now, the anterior portion of the leg has these 4 large muscles. And it's a little tricky when we're talking about the front of the leg. Here's the thing. The front of the leg, or the quadriceps muscle, the 4 muscles, its main job is to perform knee extension. The main job of the 4 muscles is knee extension. So the front part of your leg, the quadriceps muscle, all together, there are 4 of them. Quad equals 4. And those 4 muscles work together to perform knee extension. The quadriceps are the prime mover of knee extension. And together, this is a very powerful muscle group, very strong muscle group. So the 4 muscles that make up the quadriceps group is the rectus femoris, and then there are 3 vastus muscles. 3 vastus muscles. You have the vastus lateralis, you have the vastus medialis, and you have the vastus intermedius. The vastus lateralis is the quad muscle on the lateral side of the leg. The vastus medialis is the vastus muscle on the medial side of the leg. If you've ever heard of the letters VMO, stands for vastus medialis oblique. In my opinion, the prettiest muscle in the body. That's the teardrop muscle on the medial side of the knee. And the vastus intermedius is between the lateralis and the medialis. Those 3 muscles only cross one joint. The vastus muscles only cross the knee joint to perform knee extension. Rectus femoris goes over 2 joints. It crosses the knee and assists with knee extension, but it also crosses the hip, making rectus femoris a hip flexor. So, 4 quadricep muscles. The main movement of the 4 muscles is to perform knee extension. Now, the way these muscles work is that they all converge on the distal portion of the femur, and they create a quadriceps tendon. All right, so all 4 of these muscles come together on the right and the distal femur and create a quadriceps tendon. The quadriceps tendon will then advance and go over the patella. all right? That small bone in your knee, your kneecap, that is known as the patella. And the quadriceps tendon goes over the patella. What happens is the quadriceps tendon then changes as it gets over the patella into the patella tendon. All right. So the quadriceps tendon from the four muscles get to the patella. At the patella, it becomes the patella tendon, and it crosses over the patella as the patella tendon, and it inserts into the tibial tuberosity of the tibia. The bony projection on the anterior proximal area of the tibia, not the pes anserine. Remember, I said the pes anserine is the anterior medial portion, anterior medial proximal portion of the tibia. The tibial tuberosity is the anterior proximal. It's right in the middle of the tibia. And the tibial tuberosity is the insertion point of the patellar ligament, which is created from the quadriceps tendon, which is the confluence of all four of the quadricep muscles. Now, the most superficial muscle in this anterior compartment is known as the Sartorius muscle. Now, the Sartorius and the rectus femoris sometimes get confused because they each have different actions, but more importantly, they each have different origins. A little information real quick. The Sartorius is the longest muscle in the body. It is also known as the talar muscle. And the reason it is called that is because back in the day when we had tailors fixing our clothes, they would actually cross their leg. They would cross over their legs in order to help them perform their job. Well, it's the Sartorius muscle that does that action. So the Sartorius muscle is the longest muscle, most superficial muscle in that compartment, and it's also known as the talar muscle. It's just a little information. National exam will never ask you a question on what muscle is the talar muscle. If they ever did, chalk it up as wow, and you're lucky that you got a question like that, because that one you should never, ever, ever get. But if you do, cool beans. So let's go through this quadricep muscle, this anterior compartment, and the difference between the Sartorius and the rectus femoris. So the Sartorius muscle is another one of those muscles that is a two-joint muscle. It crosses two joints. So the Sartorius has an origin at the ASIS, the anterior superior iliac spine. So the Sartorius is ASIS. Rectus femoris has its origin at the AIIS. Two different origins, and it's very important that you know it. Sartorius, ASIS, Sartorius, ASIS, the S's. Rectus femoris is AIIS, right? Sartorius, ASIS, rectus femoris, AIIS. So the Sartorius has its origin at the ASIS. It inserts into the medial anterior proximal portion of the tibia. That's this area right here. That area is known as the pes anserine. Remember, I said that there's 3 muscles that insert into the pes anserine. We now have Sartorius, and the first muscle we spoke of was the Gracilis. So 2 of the 3 muscles that insert into the pes anserine is Sartorius and Gracilis. Sartorius is innervated by the femoral nerve, and Sartorius has a lot of actions. It has a lot of actions because it crosses 2 joints. So it's going to have action at the hip, and it's going to have action at the knee. At the hip, it does hip flexion, it does hip abduction, and it does lateral rotation of the hip. All right, it's a lateral rotator, just like those 6 muscles. The obturator twins, the Gemelli twins, Quadratus Femoris, and Piriformis. Sartorius is a lateral or external rotator. So at the hip, hip flexion, hip abduction, hip lateral rotation. The actions at the knee is it does knee flexion. And a lot of people don't realize that there is an actual rotation at the knee. That rotation helps lock the knee into place. We'll be talking about that in kinesiology. If the knee rotates too much, you're going to tear a lot of ligaments, a lot of cartilage. Very, very dangerous to rotate. But there is a rotation factor at the knee. So the Sartorius at the knee does knee flexion and knee internal rotation, internal or medial rotation. So Sartorius at the hip, hip flexion, hip abduction, hip external lateral rotation. At the knee, it does knee flexion and knee internal rotation. Those are the jobs. Sartorius is the one of 3 muscles that inserts into the pes anserine. Right now, the only other one we know Sartorius and we know Gracilis. And remember, Sartorius has its origin at the ASIS. Sartorius, ASIS. Now let's get into the quadricep muscle. So here's a picture of a cadaver thigh. All right, we got the rectus femoris on the top. Sartorius is coming through and around to the anterior portion. Here's another picture. The picture on the left shows Sartorius and rectus femoris there. And the picture on the right is basically showing the vastus muscles of the quadricep. And again, like I said, when we're talking about the quadricep, the rectus femoris has an action at the hip because its origin is at the AIIS. You'll notice that these 3 vastus muscles all insert on the femur. It has nothing to do with the hip. Nothing to do with the hip. So the vastus group has no hip actions. The vastus group of muscles only do knee extension. Only do knee extension. The vastus group. So the first of the quadriceps muscle is our two joint muscle, the rectus femoris. Now, the rectus femoris, like I said, people get confused between the origin of this muscle and the sartorius. When we're talking sartorius, it starts with an S, which means it starts at the ASIS, the anterior superior iliac spine. Rectus femoris has its origin at the AIIS, the AIIS, the lower portion of the hip bone. It inserts into the tibial tuberosity via the patella tendon. Remember, all four of those muscles connect, creating the patella tendon, creating the quadriceps tendon, goes over the patella as the patella ligament and inserts into the tibial tuberosity of the tibia. Rectus femoris has an innervation of the femoral nerve. Let me come down to the bottom here first. I'm going to circle this. The rectus femoris is the only muscle of the quadricep group that crosses the hip. Remember, the quadricep group is made up of four muscles: rectus femoris and the three vastus muscles, lateralis, medialis, and intermedius. The vastus group does not cross the hip. Only the rectus femoris crosses the hip. The job of rectus femoris: at the hip, it flexes the hip, and at the knee, it extends the knee. So again, this is a two-joint muscle, the rectus femoris. It has an action at the hip, it has an action at the knee. And they're opposite of each other. If you know that the quadricep muscle, including the rectus femoris, extends the knee, and I'm telling you that it does the opposite job at the hip, that means it does flexion at the hip. So it flexes the hip and extends the knee. And remember, rectus femoris is the only quadricep muscle that crosses the hip. Here's the other three muscles of the quadricep group, and this is the vastus group. Again, the vastus group is telling you by its name where it's located. Vastus medius is on the medial side of the femur. Vastus lateralis is on the lateral side of the femur. And vastus intermedius is between the medius and the lateralis. As you can see, their origin is on the femur. That's all I need you to know. The vastus muscle's origin is on the femur, and it inserts into the tibial tuberosity via the patella tendon and by the patella ligament and the quadriceps tendon. The job of the vastus group is to perform knee extension. That is the only job of the vastus muscles, knee extension. And it's innervated by the femoral nerve. So one more time. Rectus femoris comes from the AIIS. That's its origin. It inserts into the tibial tuberosity. The vastus group comes from the femur, goes to the tibial tuberosity. Rectus femoris has a function at the hip. The vastus does not. Rectus femoris does hip flexion, but the quadriceps as a unit, all four of them together, does knee extension. That is the job of the quadriceps muscle, is knee extension. And the three muscles are innervated by the femoral nerve. So we've gone from the hip to the medial portion of the leg. We've just done the anterior portion of the leg. Now we're going to do the posterior portion of the leg. This is the hamstring area. When we talk about hamstrings, the main function of the hamstrings is to flex the knee. The main job of the hamstring muscles, and there are three hamstring muscles, the biceps femoris, semitendinosus, and semimembranosus. The main job of those three muscles together is to flex the knee. To flex the knee. So when you do a leg kickback with your knee bent, that is the hamstrings working, whether you're doing it in standing or whether you're doing it in the prone position, where you bring your leg back like this. That is the hamstrings performing flexion of the knee. All right. Let's go over two of the three hamstring muscles. All three of the hamstring muscles have the same origin. They all come from the ischial tuberosity. They all come from the ischial tuberosity. But they each have different insertions. And you need to know the insertions of each of these three. Let's start with semitendinosus. Now, let me say this for future use. It is the semitendinosus muscle, more specifically the semitendinosus tendon, that you will be able to palpate easier between the semitendinosus and the semimembranosus. Semitendinosus is more superficial. Semimembranosus is deeper. So like I said, all three of these muscles, membranosus, tendinosus, and biceps femoris, all start from the ischial tuberosity. Semitendinosus inserts into the anterior medial proximal area of the tibia. Remember, that area is known as the pes anserine. Remember, I said there are three muscles that insert onto the pes anserine. The first two were Gracilis and Sartorius. The third muscle that inserts onto the pes anserine is the semitendinosus. The semitendinosus inserts onto the pes anserine. So you now know the three muscles that insert onto the pes anserine. The pes anserine is located on the anterior proximal medial portion of the tibia. And those three muscles are Gracilis, Sartorius, and semitendinosus. You will need to know that. It is very important. The deeper muscle of the between the semimembranosus and semitendinosus is semimembranosus. Now, one other thing. when you're looking at these two muscles are located on the medial side of the back of the thigh, on the medial side. Biceps femoris is on the lateral side. So these two muscles are on the medial side. Semimembranosus has its origin at the ischial tuberosity, just like tendinosis and biceps femoris. But semimembranosus inserts into the medial condyle of the tibia, the flat portion of the top of the tibia, the flat portion of the top of the tibia. So semitendinosus inserts into the pes anserine with Gracilis and Sartorius. Semimembranosus goes into the medial condyle of the tibia. Both of these muscles are innervated by the sciatic nerve. Now, like I said, these muscles are two joint muscles, which means they're going to have actions at the hip and actions at the knee. At the knee, they flex the knee, and just like the front, remember the rectus femoris extends the knee and flexes the hip. Semimembranosus and semitendinosus flex the knee and extend the hip. So the hamstring muscles flex the knee. Semitendinosus, semimembranosus, and biceps femoris all have actions at the hip, and the action at the hip is hip extension. Remember I said semitendinosus is the most superficial of the two muscles, and they're located on the medial side of the leg, where the biceps femoris is found on the lateral side. So that's two of the hamstring muscles. The biceps femoris is the third of the hamstring muscles. Again, the biceps femoris is located on the lateral side of the leg. Biceps means two heads. It does have two heads. The long head is on the ischial tuberosity, and the short head is on the back of the femur, that linea aspera area. How you doing, Ashley?
Hi, good.
Yeah, we got a, I don't know if you got my message that we're going to be going from 12:30 to 2:30 today.
Oh.
Because I got a meeting, so.
That's fine, I'll catch the end and then go later.
I'm sorry?
I'll just catch the end of whatever you're doing and I'll go later.
Sounds good. I'm trying to finish up the leg.
All right, awesome.
All right, so thanks for coming. So like I said, biceps femoris has two heads, just like semimembranosus and semitendinosus. Its origin is the ischial tuberosity for the long head, and the short head comes from the linea aspera. Remember I said that semimembranosus and semitendinosus of the hamstrings are on the medial side. Biceps femoris is found on the lateral side of the body. The biceps femoris inserts into the head of the fibula. Its insertion is into the head of the fibula. Its innervation is the sciatic nerve. I'm not worried about you splitting it up between the tibial branch and the peroneal branch right now. Just know it's the sciatic nerve. Remember, the biceps femoris is a two-joint muscle, which means it's going to have an action at the knee and it's going to have an action at the hip. Just like semimembranosus and tendinosus, they kind of do the same thing. They flex the knee and they extend the hip. Biceps femoris also does a little external rotation at the knee. Okay, also does some rotation at the knee, but more importantly, The hamstrings as a group flex the knee, and each of them go over the hip, and so each of them extend the hip. The ligaments of the knee, and this is something important that I do want you to know, because this is one of the money-making things that we as physical therapist assistants work on all the time. We work on the knee, and we work on these ligaments that tear and get pulled, and it's incredible work, usually seen in athletics. Remember, ligaments are tissue that attach bone to bone. A tendon attaches a muscle to bone. So in the knee, we have a lot of important ligaments. We have ligaments that are on the sides. The ligaments that are located on the sides are known as medial and lateral collateral ligaments. Now, what these ligaments do is that they attach the femur, and on the lateral side, it attaches to the fibula, femur to fibula, and on the medial side, it's femur to tibia. So it strengthens these collateral ligaments, medial and lateral. It strengthens the area on the lateral side and on the medial side of the bone. Okay, so it offers stability, because if you take a look at this, structure here, all that's holding it together are these ligaments. All right, you take away these ligaments, and the femur is going to come away from the tibia. All right, there's no suction here. There is a joint, and there's a joint capsule there, but it's not enough to keep it attached. It's these ligaments that basically keep the structure attached to each other. So the medial collateral ligament gives stability to the inner part of the knee. So here's the medial collateral. So if that's on the medial side, that's actually the right leg that you're looking at. You're looking at the front. Here's the front. The patella would be right here. Here's the medial side. So if you're on the medial side, this makes this picture a right side. Okay, so here's the medial collateral ligament, and that's stabilizing the inner part of the knee. The lateral collateral ligament stabilizes the outer portion of the knee. Now, we have a lot of forces. If you watched a football game yesterday, you watched some guys tackling people on the medial side, causing force to go in this direction, putting a lot of pressure on that lateral collateral ligament. Something you'll learn in kinesiology. It's incredible stuff. Now, the other set of ligaments that attaches the bone to bone is the anterior and posterior cruciate ligaments. Now, cruciate means X. Cruciate means X. So if you look here from the front, because we're looking at it from the front, this ligament that's going like this, that's going from the medial tibia to the lateral femur, is the anterior cruciate ligament. It's on the anterior side. It's causing part of a cruciate, and it's a ligament because it attaches bone to bone. what the anterior cruciate ligament does, it prevents forward motion of the tibia. Now, what got me into this field was back in 1991. I'm sure a lot of you were not born then, which means my knee is older than most of you guys. In 1991, I tore my ACL. I also tore my medial collateral ligament and my medial meniscus. I didn't know anything about that. Like I told you guys, I was a supermarket manager before. And I tore this and I had to go for major surgery, all right, to fix it. I have some screws in my knee. I have my patella ligament. Part of my patella ligament was harvested to create an anterior cruciate ligament. And knock on wood, going on 29 years without any problems. So my knee is older than most of you guys. So I tore my ACL. That's what got me into this field. So the anterior cruciate ligament keeps the tibia from going forward. As you can see right here, there's another ligament, and that's known as the posterior cruciate ligament. It's on the posterior side. It's a cruciate ligament. It's creating the other part of the X. The posterior cruciate ligament keeps the tibia from moving backwards. So what I'm going to need you to know, this will not be on your practical, but any information on this slide, I can give you on my quizzes. So know the job of the medial and lateral collateral ligaments, and know the jobs of the anterior and posterior cruciate ligaments. We will talk about these ligaments more in kinesiology. So now we're going down the leg a bit. We're going to hit the calf muscle. The calf muscles are now a posterior compartment. I'm not going to ask you any information from this slide, so you don't have to worry about this slide. So we'll talk about first the anterior compartment of the leg, the front of the leg. When we're talking about the front of the leg, we're talking about muscles that dorsiflex the ankle, that bring the toe towards the tibia, brings the toes towards the tibia. There are basically four muscles that perform this action. The main one is the tibialis anterior. We also have extensor hallucis longus, extensor digitorum longus, and fibularis or peroneus tertius. Now, let's kind of go over those muscles before we hit them. Tibialis anterior. The name is telling you where the muscle is located. It's located on the tibia in the front on the anterior side. Extensor hallucis longus. It's telling you a couple of things. Extensor means something is going to extend. Hallucis means big toe. So the extensor hallucis longus extends the big toe, and only the big toe. But because it crosses the ankle, it does dorsiflexion of the ankle. Extensor digitorum longus. Again, something's going to extend. This time it's the digits. Toes 2 through 5 will extend. Finally, fibularis and peroneus, they can be used interchangeably. I would rather you use fibularis because fibularis is telling you where the muscle is coming from. It's coming from the fibula. It's coming from the fibula. Okay? So let's go through these muscles. Tibialis anterior. Remember I said it's on the tibia, it's on the anterior side. Definitely visible. Definitely visible. Here's the front side of the leg. All right. You could see the patella right there. The patella kind of guides you there. Also, this tibial tuberosity right here tells you it's the anterior side. That muscle is coming from the tibia. So its origin is from the tibia right here. It crosses over and inserts onto the first metatarsal, the long bone. So from the proximal tibia, the lateral condyle, here's the lateral side. I know it's the lateral side because the fibula is right there. It comes from the proximal lateral tibia to the medial first metatarsal, the first medial cuneiform. Because it's on the inner half here, it does inversion of the foot and it does dorsiflexion of the ankle. So the main two jobs of tibialis anterior is dorsiflexion of the ankle and inversion of the foot. Now, a disease process that you'll see, if this muscle is weak, what that means is that the foot will not be able to come up. When you walk, in order to clear your foot, you actually bring your toes towards your nose. Well, if tibialis anterior is weak, those toes will not go towards the nose. The toes will actually drop towards the floor. And you can catch your toes on the floor. And when your toes go towards the floor, it's known as a foot drop. A foot drop. And a foot drop occurs when the tibialis anterior muscle is weak. The peroneus or fibularis tertius, remember I said I would rather you know it as fibularis because it's telling you where this muscle is starting. It's starting on the fibula, right here. Here's the lateral side. So here's the fibula, guys. This is the lateral side. Fibularis tertius is starting on the fibula, the distal fibula. It goes down, it takes a turn, and it goes to the base of the fifth metatarsal. Base of the fifth metatarsal. So this muscle is on the outside of the foot. Remember, tibialis anterior was on the inside, so it did inversion and dorsiflexion. Fibularis tertius does eversion and dorsiflexion because it inserts onto the lateral side of the foot. Okay, so tibialis anterior, dorsiflexion inversion, fibularis tertius, dorsiflexion and eversion of the foot. Extensor digitorum longus. It's telling you it's going to extend something. It's telling you it's going to extend the digits. It's going to extend digits 2 through 5. So it comes from the lateral condyle of the tibia. It inserts onto the toes of 2 through 5. Its job is to extend toes 2 through 5, dorsiflexion of the ankle, and it also does some eversion of the ankle, just like fibularis tertius. Extensor digitorum longus, a muscle that extends the toes. It also does dorsiflexion and eversion also. Extensor hallucis longus. Again, the muscle is telling you the action that it does. It's going to extend something. Hallucis means big toe. So remember, digitorum is digits 2 through 5, doing nothing at the big toe. But extensor hallucis longus does do an action at the big toe. Extensor hallucis longus comes from the fibula, about the mid-fibula. It inserts into the great toe. It extends the great toe and dorsiflexes the foot. This muscle does nothing with inversion or eversion. So again, the 4 dorsiflexors, tibialis anterior, does dorsiflexion and inversion. Fibularis tertius does dorsiflexion and eversion. Extensor digitorum longus does dorsiflexion and eversion. Extensor hallucis longus does dorsiflexion and big toe extension. Now we're getting into the back of the leg, the back of the bottom of the leg. So now we're talking about the calf muscles. All right, there are 3 muscles. We got the gastrocnemius, which is the larger calf muscle. That muscle is a 2-joint muscle. So this muscle, the gastroc, actually crosses the knee and crosses the ankle. Right underneath the gastrocnemius is the soleus muscle. The soleus muscle only crosses 1 joint, only does an action at the ankle. We have a muscle known as plantaris. You're not going to, excuse me, you're not going to need to know plantaris. I'll tell you what you'll need to know about it, but it's not something that I'm going to put it on the test. When you're talking about, and I just want you to know this phrase because national exam could put it on there. When you're talking about the gastrocnemius and the soleus together, they are known as the triceps suri. The triceps suri. And the reason is, what that means is 3-headed. The gastroc has 2 heads, and you can see it in this picture right here. The gastrocnemius has 2 heads. The soleus right underneath it has 1 head. Hence the triceps suri. Now the gastroc and the soleus both insert into the calcaneus by the Achilles tendon. And that Achilles tendon is the strongest tendon in the body. So let's hit those muscles. And we are getting close to the end, guys. So, and we'll go there. All right, so the gastrocnemius, you need to know this muscle cold. The gastrocnemius has its origin on the femoral condyles. Remember I said gastrocnemius crosses the knee. Gastroc is on the femur. It's on the femur, so it's going to have an action at the knee. It inserts into the calcaneus by the Achilles tendon. So this long, thick tendon right here is the Achilles tendon, and right here is the calcaneus. So this long tendon, and it's strong. That thing snaps, you hear it for days, right? And when it snaps, when you tear Achilles tendon, you drop like you've been shot. All right. If you want to see it, go onto YouTube, put in Achilles tendon tear football, and you will see these guys running, and all of a sudden their Achilles tendon tears and they drop to the ground like they've been shot. It is sudden and quick. The gastroc is innervated by the tibial nerve. Like I said, the gastroc has two jobs. At the knee, it flexes the knee. And at the ankle, it plantar flexes the ankle. It pushes the toes downwards. So the gastrocnemius does knee flexion and ankle plantar flexion. Knee flexion and ankle plantar flexion for the gastrocnemius. The soleus is right underneath the gastrocnemius. The soleus is deep. The gastrocnemius is superficial. The soleus does not cross the knee. So it has no job at the knee. It only has a job at the ankle. So the soleus comes from the fibula head. The soleus also inserts into the calcaneus. That's what makes that Achilles tendon so thick, because both of the tendons from the gastroc and the soleus combine to create that Achilles tendon. Again, the soleus is a tibial nerve innervation, and the only job of soleus is to plantar flex the ankle. The soleus looks like a fish. The soleus muscle, if you were to put it to the side and look at it sideways, looks like a fish. Now, I wrote something on the bottom that is important for you guys to know. In order to palpate the soleus muscle, the knee must be flexed. In order to palpate soleus, because remember, gastroc is a big, thick muscle, and it's covering soleus. When you flex the patient's knee, the soleus will actually come out the side of gastroc, and you'll be able to palpate it. It will be one of the muscles that you need to palpate in kinesiology. So again, in order to palpate soleus, you must flex the patient's knee. You have to. If you do it with a leg straight, you're palpating the gastrocnemius. So gastrocnemius and soleus, they both plantar flex the ankle. The gastrocnemius also flexes the knee. Righty? Now, plantaris, you will not need to know. All right? You will not need to know. Remember when I spoke about the upper extremity, I spoke about the palmaris longus. It was the palmaris longus is that muscle that only about, some people have it and some people don't. But it's also a muscle that can be used to harvest ligaments for surgery. Well, plantaris has the longest tendon in the body. All right, this really long, thin tendon. And as you can see, the muscle is very, very short. Plantaris is a weak plantar flexor. It's also a very weak knee flexor. So it works with the hamstrings also, plantaris. But if a tendon is needed, plantaris is one of the few muscles in the body that you really truly don't need. So they will actually cut the plantaris muscle and use the tendon for surgery. So for our purposes, you will not need to know this muscle. Just know that it's used in a lot of surgeries. Almost to the end here. We're coming close. So now we're going to talk about some more of the posterior group muscles, and a muscle at the knee that's really, really important at the end. Okay, so tibialis posterior. When we get into kinesiology, we're going to talk about three muscles. We call them the Tom, Dick, and Harry muscles. The Tom, Dick, and Harry muscles actually come around the medial side of the foot, and they kind of come in order. And that's why they're called Tom, Dick, and Harry, because there's a T for Tom, there's a D for Dick, and there's an H for Harry. So the tibialis posterior is the Tom muscle. All right, it's the Tom muscle. So again, the name of the muscle is telling you where it is. It's located on the tibia, and it's on the back. It's on the posterior side. Tibialis posterior has three important jobs. It plantar flexes the ankle, it inverts the foot, and it adducts the ankle. Plantar flexion, inversion, and adduction. It is the Tom muscle. All right. It is the Tom muscle of Tom, Dick, and Harry. Tibialis posterior. The D muscle is the flexor digitorum longus. Again, the name is going to help you. This muscle is going to flex, and it's going to flex the digits. It's going to flex the toes. So it comes around the medial portion, as you can see in this picture here. All right. The medial malleolus is right there. And the Tom, Dick, and Harry muscle follow all the way like this. Okay. The job of the flexor digitorum longus: flex the toes, inverts the foot, is a plantar flexor. So you got tibialis posterior, you got flexor digitorum longus. They come from the same area. They do many of the same things. They invert the foot, they plantar flex the ankle, they adduct the ankle. The Harry muscle is the flexor hallucis longus. Again, the name is telling you what it's going to do. The muscle is going to flex. The muscle is specifically going to flex the big toe. Hallucis means big toe. So again, this is the Harry muscle. So Tom is tibialis posterior. We got flexor digitorum. We got flexor hallucis. The job of this muscle: flexes the big toe, and it does the same thing as the other two: inversion of the foot, plantar flexion of the ankle, and adduction of the ankle. So the actions is what I want you to know. The actions are what I want you to know of this group of muscles. Finally, we have the popliteus muscle. The popliteus muscle is a very, very important muscle, and I need you to know this muscle. I'm not worried about its location. I'm not worried about origin, insertion, or innervation. You must know the action of this muscle. If you're standing up with your knee straight and you want to unlock your extended knee, it is the popliteus muscle that unlocks a fully extended knee. It allows for flexion of the knee. So the job of the popliteus muscle is to flex the knee from a locked position, and it does this by medially rotating the knee. This is the key to unlocking your knee. If this muscle is not working, your knee will actually stay in the extended position. Your leg will be straight all the time. Understand this, when you ambulate and you walk, you have to flex your knee to advance your leg. If this muscle is not working, you'll be circumducting your leg, pulling it around in a circle to advance it. So the job of the popliteus is to unlock a fully extended knee. It flexes the knee from a locked position by medially rotating the knee. And believe it or not, that will be it. Oh, I forgot. Oh, sorry. Fibularis, longus, and brevis. We got to do those two. Remember, I said you wanted, it's either fibularis or peroneus. Fibularis is telling you where it's coming from. Both of these muscles, and I just need you to know their action. Both of these muscles plantar flex and evert the foot. They evert the foot because their insertion is on the lateral side. My picture here, sorry about that. The insertion is on the lateral side. It's here and it's here. And that's the lateral side. So it everts the foot. And it also helps with plantar flexion. All righty. Now that's it. The rest of these muscles that you're going to see on this PowerPoint are what they call intrinsic muscles. These are muscles that stabilize the foot and support the arches. You will not need to know all of these muscles. There's about 25 of them there, and you do not need to know them. So don't worry about those muscles at the end. All righty. Stop the sharing. All right. So tomorrow, what we're going to do is I'm going to bring back the bones. But now what I'm going to do is I'm going to correlate the bones with the muscles. All right. So if I talk about the external occipital protuberance, I'm going to talk about that as being the origin for the upper trapezius. If I'm talking about the greater tubercle of the humerus, I'll be talking about three muscles: supraspinatus, the infraspinatus, and the teres minor, that sit on that area. Now, when we get into class in 5 weeks from today, when I'm going to go over everything, when I do a quiz, I'll be able to say, one of my questions could be, the upper trapezius has an origin point at what bony landmark? And I could put the temporal bone, the frontal bone, the styloid process, the external occipital protuberance. So you guys have to start putting these things together. So my recommendation, we're 5 weeks out now. Remember, when we started this, we were 7. When we finish it, we're going to be 3. The time goes quickly. I am telling you guys, try to spend at least a half an hour a day. Get the bones out of the way, start working on the muscles. When you get all the muscles, then bring the bones back like I'm going to do tomorrow, probably tomorrow and Wednesday. So really begin, if you haven't started already, you really need to start soon, because here's the thing. In week 1, I'm going. I'm not stopping. All right. Week 2, the end of week 2 is your bone practical. That, I'm going to be honest with you, that's pretty darn easy. The bone practical is going to be easy. And actually, so is the muscle, because all you're doing is identifying now. So, but on my quizzes are going to be tough. All right. That's why you've really got, that's why we're doing this now, trying to get you guys going on this stuff now. All right. Ashley, any questions?
I'm good. Thank you.
All righty. So tomorrow will be regular time. I'll be 2 to 4 tomorrow.
Okay.
Okay.
Yep.
All right. Fantastic.